spine surgery can help you return to an active lifestyle. If back pain has taken you out of the game, whether that's golf, gardening, or just walking, you may be wondering if spine surgery can help you get back to the life you love. In this video, I'll explain to you how surgery can restore function, reduce pain, and put you back into motion. Hi, I'm Dr. Deeptee Jain. I'm a board-certified orthopedic spine surgeon. Every week, I meet people who are hesitant about spine surgery, as they should be. Spine surgery comes with risks, but also desperate to move again. When non-operative care isn't enough and it's just not working, spine surgery can be the tool that helps you reclaim your active lifestyle. So let's talk about how and why it works. Not every case of back pain will get better with an operation, but when there's nerve compression or spinal instability, that is abnormal motion in the spine, or structural abnormalities like a deformity that hasn't responded to physical therapy, medications, potentially different kinds of injections, surgery might be the best path forward. The goal isn't just about pain relief, it's about getting you moving again. Spine surgery can help in 3 key ways. Number 1, it removes pressure from any pinched nerves. Number 2, it can stabilize segments that are moving in abnormal ways. And number 3, it can restore alignment so that if your spine is deformed, it can go back into the right place to allow your body to move properly. When done right, spine surgery improves pain and also restores your freedom of movement. I've seen patients return to hiking trails that they never thought they'd walk again, or play sports again without flare-ups, or pick up their kids or grandkids without fear, or even simple things like just walking a few blocks in a grocery store. These aren't small wins, they can be life-changing. Modern spine surgery isn't how it was done 20 years ago. Today, we often use minimally invasive techniques, and this means keeping the muscle envelope intact. This can reduce blood loss, lower infection risk, and help patients recover faster. This means less time in the hospital, and frequently, I personally perform spine surgery very frequently as an outpatient, and more time getting your life back. Recovery varies, and it's actually a topic of a separate video, but here's what you can usually expect. Walking is expected the same day of surgery, almost always. Light activities within 1 to 2 weeks, and physical therapy beginning soon thereafter. Most people see substantial gains in 6 to 12 weeks and keep moving from there. So who's a good candidate for spine surgery? Like I said, spine surgery isn't for every single patient, and it's not for every single condition. Persistent pain that hasn't responded to other treatments, radiating symptoms, in other words, nerve-related symptoms like numbness, weakness, or pain going down the arms and legs, structural issues, and this one's really important, structural issues that are confirmed on imaging that actually match with the symptoms that you have. As surgeons, we actually have to operate on something. We have to be able to visualize what we are fixing. And a strong desire to return to an active lifestyle. You have to want it. Finally, you have to also be healthy enough to undergo spine surgery. Regaining your physical abilities can lift more than just pain. It can boost confidence, energy, sleep, and even mood. Movement isn't just mechanical function. It's a foundation for living well. I'm an orthopedic surgeon, and that's why I do surgery. Spine surgery can give that back to you. So to recap, spine surgery can relieve pain, restore function, and stabilize movement. Today's techniques are safer and more targeted than ever. Most patients recover well and return to the activities that they want to do. And surgery can be the first step towards living and not just coping again. So if you've been sidelined by back pain and are wondering if surgery can help, drop a comment or hit like. I'd love to hear your goals. And don't forget to subscribe for clear, compassionate answers about your spine health journey.